Hi there, and welcome to the very first episode of Pharmacy for the People. I have been really excited about this for the months leading up to this and the preparation that's involved, but you can't be excited about this until you know what it is. I'd like to dedicate this first episode to explaining what Pharmacy for the People is all about by answering three main questions. Question number one, what is this channel for? Question number two, why am I putting in the effort to create it? And question number three, why should you listen to anything I have to say? So let's start with number one, which is a great place to start unless you're Quentin Tarantino. Number one, what is this channel for? This channel is dedicated to taking everyday concepts that we use in medicine and pharmacy and breaking them down so that the casual listener or medication user like you can apply them to yourself or to the people that you love. Concepts like anatomy, pathophysiology, concepts like pharmacokinetics, evidence-based medicine, Occam's razor, the trans-theoretical model for change. Okay, question number two, why am I putting in the effort to create the channel? I want to answer questions that no one's been able to answer for you. And I want to be able to answer questions that you didn't even know that you had. I'm sure you've asked yourself questions like,
what did that doctor tell me this medication was for? How was I supposed to take this?
But did you also know that a lot of pharmacists don't fill prescriptions? Did you know that there are more than 2 types of diabetes? Did you know that physicians have to be good at statistics? Did you know that certain essential oils can actually kill bacteria? What's safe for my kids? Why do drug commercials sound like they're a death trap? Why are there 13,000 cold medications? Where do all these meds even come from?
Doesn't natural mean safe?
In other words, I'd like to bridge the gap between the good people who take medications and the good people who prescribe medications. Decades of education and practice go into becoming a good healthcare provider. Does that mean that you, the healthcare consumer, also has to put in the same amount of time, effort, and money? Obviously, that's not going to work. But you deserve to know these things because this is your health. You deserve to know why your physician is asking you to take this medication. You deserve to know why there are side effects. You deserve to know why you stand in line for 30 minutes before someone finally slaps a label on a vial and charges you too much money for a prescription. But most of all, you deserve to be an informed patient or caregiver. There is a lot of misinformation out there right now. A lot. People are trying to make money off of you. They're trying to mislead you for their own sake. And some people are just confused. They've gotten information from an untrustworthy source, and they just care about you, and so they're sharing this untrustworthy information with whomever they can. I wouldn't fault them for that, but you need to know where to go to find good information and to know how to tell if information is trustworthy. Which leads me to question number 3. Why should you trust a word that I say? Let me answer this question with 3 points of its own. First, as I said earlier, my goal is to empower you. I'm not going to tell you what to do. I want to give you the tools necessary for you to be able to make decisions for yourself. Second point, as such, I will do my best to speak without bias. Now, some topics that we cover fill me with a big old bottle of vitriolic rage. And when we get to those topics, I'll do my best to be honest with you and open and tell you why I feel the way that I feel. But I'll try not to let that influence the information that I tell you, and try to divide between the way that I feel and what the information says. And my last point for why you should trust a word that I say, I need to introduce myself. Hi, my name is Dr. James Gardner. Now, that doctor refers to my doctorate in pharmacy, not a medical degree, not a doctor of medicine. Now, my educational title gives me the title of doctor, but I generally won't use that terminology here because it can be a little confusing. Where's the doctor? Oh, he's standing right over there next to the other doctor, and the doctor of physical therapy, and the doctor of medicine, and the doctor of osteopathy. I earned my bachelor's in biochemistry from Virginia Tech. I got my doctorate of pharmacy from the Medical University of South Carolina down in Charleston, South Carolina. And I currently practice as a pharmacist in Virginia, which you may fact check using the Virginia Board of Pharmacy if you would so like. Now, the reason that I waited until the very end to tell you that I'm actually a pharmacist is because I want you to be able to determine for yourself if the information that I'm giving you is trustworthy in and of itself, not just because I am a pharmacist or because I practice medicine. Now, I understand that it constitutes a bit of a circular logic for me to be the person that is giving you the tools to decide if information is trustworthy, and I'm asking you to determine if that information is trustworthy in and of itself. But I'm hoping you'll find enough external corroboration that you'll forgive the conflict of interest there. But I'm not just a pharmacist. And please listen to me when I say this, because this is very important to me. I'm not just a pharmacist. I'm just a man. I was a baby. I grew up through childhood. I had deep relationships with really good friends. I had parents that corrected me and loved me. I have grandparents. I have strengths. I have weaknesses. I have a beautiful wife who helps keep me grounded and keep my head out of the clouds. I have a beautiful daughter named Ariel, who is currently still enjoying my wife's womb. My point here is that when I hope that you trust me, when I give you information, it's not because my title demands that you listen to me or trust me. I hope to earn your trust as someone who just wants to help. I want to help. Also, I have a cat. So there are the big three. What is this channel for? Why am I putting in the effort to create it? And why should you listen to a word I have to say? Thank you for joining me so much again on this very first episode of Pharmacy for the People. I hope that you'll come back and hear other things I have to say. I hope there's a lot of topics out there that you're really excited to hear about. I'm excited to make the videos. Again, thank you very much, and I'll see you soon. But most of all, you deserve to be an informed patient or caregiver.